Hello, good afternoon. This is Dr. Do again. This video is on alphabetic list of problem. Continue with letter D. Today I'm going to talk about dysphagia. What is dysphagia? It's just a fancy term for difficulty swallow. Is there any emergency situation associated with this dysphagia? Yes. If this dysphagia has been going for a while and couldn't eat well, couldn't drink well, malnutrition, and also especially if the electrolytes imbalance can be very dangerous, either dehydration or electrolytes imbalance, so that could be causing neurological or cardiac problems. So if that's the case, or even lose consciousness or the arrhythmia, so if that's the case, then it is emergency situation. Usually the dysphagia is kind of chronic. It's not just one time. What are the causes? Is there any dysphagia you can manage at home? Probably not, because you cannot swallow. Then turns out will be malnutrition. Like I said, malnutrition, any problem. Depends on the causes. There are many causes for this dysphagia. The one, for example, if there's one of the condition called acalasia, which means the esophagus, a junction of esophagus stomach, there's a sphincter. If that sphincter is constricted, spasm, so then there's no food or water passing down. So that is the problem to cause this dysphagia. And also associated with other systemic disease. For example, there's a sclerosis, generalized sclerosis. Not only the skin constriction, like the hand feels stiff, cannot open up, and the internal organs, like esophagus is one of it, can cause the sclerotic, loss the function of peristalsis, which cannot move, so cannot pushing the food downward. So that's another cause for dysphagia. Or the other problem, like actually one of the serious problem is the cancer tumor. At the beginning, if it is cancer, at the beginning it's solid food. Dysphagia only for solid food, and with the progression, the cancer grow bigger and bigger. Then eventually becomes dysphagia even to the liquid cannot passing down. So these are the major causes I can think to cause this dysphagia. Usually, if I just start from the beginning in the structure of the esophagus and the stomach, right? There's a junction, and that there's a sphincter, like the circular muscular structure serve as the gated structure to open it up, food going down, or to close it up, to close down so that no food can passing. The purpose for this is actually to prevent the reflux. So if the long-term reflux, the acidic content from the stomach backward to the esophagus can cause this kind of dysphagia also, because the esophagus is damaged, lost the normal structure, can lose the ability of peristalsis, so cannot contract and dilate to push the food down to the stomach. So this is the dysphagia. What is about? What are the causes? And what is the consequences of this dysphagia? Like I said, seems probably. And before I talk about the complications or consequences, there's another problem. It's not associated with dysphagia, but it could lead to the same consequence, like a lost food intake, lost appetite, and lost nutrition. Eventually becomes the electrolyte imbalance. That is the mesenteric artery ischemia. So which is the thrombosis. We know the thrombosis, if the thrombosis fall into the coronary arteries and cause the cardiac attack, the malfunction of the heart muscles. But if that thrombosis fell into the mesenteric blood vessels, we know the mesenteric is the structure to hold the small intestine together. We have long small intestine. If it is stretched, there's no way to hold in our abdomen. So this mesenteric structure is the very thick connective tissues, so to fold this small intestine into fan-shaped. And their blood vessel to supply the small intestine running in between these connective tissues. If those blood vessels are clogged by the thrombosis, for example, or emboli, so cause the ischemic of this small intestine, that gives you the symptom like the postprandial abdominal pain, which means after you eat you feel abdominal pain. And this pain is kind of subtle, but it's there. And when you press it or exam, it's not like other abdominal pain when you exam or press the abdomen, make it worse. But this condition is on the opposite. You feel pain with food intake, but if you press it, you could not find objective abdominal pain. So, but this could be thinking or confused with the dysphagia. It is not. It's esophagus is normal, but just the ischemic of small intestine. So this, regardless, either the small intestine ischemic, mesenteric ischemic, or the dysphagia can cause the serious consequences. One of them is malnutrition, of course, couldn't take food, couldn't take fluid, and can cause the very serious condition is electrolyte imbalance. So the electrolyte imbalance seems like, okay, so I run 50K marathon, you might have temporary electrolyte imbalance or dehydrate, but it's quickly can be corrected because your kidneys is normal, your digestive system is normal, your whole well-being, you're normal, so you can correct it. But if this is ongoing dysphagia, cause this imbalance, cannot be corrected unless you have the fluid through the blood vessel. So that's why if the imbalance of electrolytes caused by this dysphagia could be very, because it is subtle, probably you did not realize until the moment lost consciousness caused by this electrolyte imbalance. So the point is, if you have any problem with either, like I said, the sclerotic disease, if that's the case, it's caused either genetic or autoimmune cause, then follow up with your physician, monitor your function, generalized function, whether you can swallow the liquid, whether you can swallow the solid food. Or if you have this reflux, regurgitation, see your physician regularly, even though you're treating with some medications, you feel better, but still continues to follow up. Make sure there's no other serious complications like the sclerotic of the esophagus because of scar tissue formed. That's why the scar, fibrotic tissue lost the normal smooth muscle peristalsis function. So that's could be the causes. Or if you feel hard to swallow the solid food and gradually to the liquid food, that's really serious, could be the cancer. There's another, there's another cluster category causes. It's a psychological cause. I did not mention, I think I thought. Psychological cause also can cause this problem. You think it's not a disease, it is. Mentally think, or those people think I'm too fat, not looking good, so I'm going to cut my food intake. These people, if they're going to the extreme, can be a psychological problem. So this esophagus continuously to spasm, the sphincter muscle around the esophagus and stomach junction cannot be relaxed regardless. It's just it's there. It's just cannot be relaxed. It's so psychological can cause this problem. So that kind of patient, I saw those kind of patients. It's just it comes and goes. Comes like suddenly feel vomited, everything vomited out, and if you give water, still like spilled out, like just leaking out. I saw this kind of patient. So so if that's the case, I think probably the family member or the patient itself, these are the episodes, not always. Sometimes it just comes and goes. So if that's the case, then see your psychiatrist or primary care physician to address that problem. So this is the video. I thought it's kind of simplified, very simple symptoms like the dysphagia, but I think I'm going to stop here. I hope this video helps you in one way or another, and to seek medical attention, address your problem, and treat early to prevent either to prevent the malignancy or prevent the progression of the disease. Thank you for watching. I will see you next time.